Meanwhile, Tock Seng Hospital reopened for admissions today. This move, which is being done gradually, comes 2 weeks after it stopped admitting patients due to the COVID-19 cluster, which had 46 cases as at yesterday.
In a Facebook post, the hospital said it has strengthened defences but acknowledged that it will never be able to eliminate all risks. TTSH also said the last case of exposure in the wards was more than 2 weeks ago.
And since then, the cases reported were already under active surveillance, in isolation at the National Centre for Infectious Diseases or in quarantine. TTSH has completed 6 rounds of testing for all inpatients and 2 rounds for all 12,000 staff on campus.
Staff will also receive more support for their mental well-being through efforts like workshops and online learning modules.
Here with the latest is multimedia journalist Kimberly Zhao. Now she's standing by outside Tock Seng Hospital. Kim, you've been there for several hours. Are there more people at TTSH today? And how are they feeling about returning to the hospital that had an active cluster?
Thanks, Haryanto. Yes, we are indeed currently standing in front of Tock Seng Hospital's main entrance, where this is the first day of their gradual reopening since the lockdown in April. Now, previously there was no one around, as you've mentioned, but that seems to have changed today. From what we have observed today at the medical centre, that certain entrances were blocked off with signs restricting access and redirecting people instead to their main entrance, where there were screening stations there to take their temperature, and that's where we actually saw a steady stream of people coming in and out. And in fact, the pharmacy had a constant handful of people. Of course, they were all safely distanced, but there was a constant handful of people that were filling up the waiting area. But it seems like that is a different story from inside the hospital, where the only non-staff people were there either for visiting or for urgent or compulsory checkups. The inside is in fact said to be emptier than usual, with one person we spoke to even calling it a ghost town. One of the visitors even said that the dining spots had their chairs stacked up and moved to the side so that no one could dine there. Now, we asked some of them for their in-depth thoughts, and this is what they had to say.
The normal procedure where they check our temperature, when we pass there, and then they ask whether we visited any, or whether we come across any COVID patient. That's a normal procedure. And then when we register they mentioned that we are only allowed for half an hour visits. There's so many things like I want to ask the doctor, ask the nurses about my mom's condition. So I think half an hour is not enough.
There are a lot of different. And then the MRT is so quiet, not much people. Then inside also is, I don't feel that more patients are actually so less people inside.
Actually, I was worried earlier. But when I came here, everything is normal. No worries, nothing. Because I believe that in Singapore, everything is well taken care of. When I came here, there was nobody. I was the only one. So I thought, how come it's so deserted? Maybe people are afraid to come to the hospital. But I feel that it's okay, no problem.
Well, Kimberly, the hospital has said that it will never be able to eliminate all risks, but what measures are you seeing currently in place at TTSH? Any new protocols?
There are a few new measures here in place to ensure safety, the first of which, as we heard, is the visitor limits, which are now limited to 1 visitor for 30 minutes every day. That means a patient can only see 1 person for half an hour, and after that they are not allowed to see any more people for that day. People are advised against coming for non-urgent procedures. We also understand that all healthcare workers are required to wear PPEs while on duty, and all staff members are to undergo swab tests every single week. And interestingly, this does include people who don't work on campus, that is, they work from home. And of course, this is on top of the existing measures such as safe distancing, mask wearing, temperature taking. And in general, it seems that people seem very comforted by these stringent measures, and the consensus seems to be that they think the hospital is doing a good job and they feel safe to come back. Although, as we saw earlier, one of the visitors did mention that she thought the half an hour visiting limit was a little short, not just to visit their family, of course, but especially considering that the 2-week gap between her being able to visit her loved one and today is a little long. So it seems that in spite of that concern, it's agreed that these measures are a necessary evil in light of the evolving situation. And that's all we have on the ground. Back to you at the studio.
Well, thanks so much for the update, Kim. That was multimedia journalist for the Straits Times, Kimberly Zhao.